There are 11 common problems that patients with scoliosis face. Let's list them. Number 1 is a potential leg length discrepancy due to the pelvis shifting and one leg becoming longer than the other. The longer side and the shorter side each end up having their own individual problems, and particularly interesting is usually the development of a bunion on the longer side. It's important to consider that the leg length discrepancy may be from a scoliosis, or you may anatomically have one leg that's longer than the other, which can cause a scoliosis. Over time, that uneven loading of the pelvis due to the curve or the leg length discrepancy can cause pelvic floor pain and dysfunction in many patients. People will always complain of pelvic floor issues on one side and go their whole lives treating it and not wondering why it's not going away. This could be due to the curve and the uneven loading pattern. Patients with scoliosis will often have TMJ issues. If you take a picture of yourself and invert it, you'll notice that your face might be asymmetrical. There's a good chance that this may be due to a scoliosis, and this causes your jaw to also be misaligned. Over the years, these loading patterns can cause wear and tear on one side, hypermobility or fixations, and this can lead to TMJ pain, migraines, grinding and clenching, and a whole host of other issues. The next is a segue into headaches and migraines, which are often contributed due to the uneven muscle loading of the neck and potential shift in C1 due to the curve, and this can cause a perpetuation of headaches and migraines that become chronic. Another common issue is uneven loading of the rib cage, which can cause rib pain and costochondritis. This is more particularly apparent in patients who have a thoracic scoliosis, and ergonomics are not carefully monitored, and overload can happen on one side, creating pain in the front or pain that wraps all the way around. The next thing is sacroiliac joint pain and sacroiliac joint arthritis or subchondral sclerosis. This is not something you commonly see, but it's more common in patients with scoliosis due to the forces going through the pelvis from the legs and hips being uneven and worse or higher on one side. This is more particularly apparent in patients who do high rep activities such as running and things that load one side of the pelvis more than the other. With that also comes hip pain. You'll have one hip that's hypermobile, one hip that's really tight, and this can cause a weird imbalance, and patients often notice this when they go to do a squat, and then they end up sitting more into one hip, which is typically the looser hip, and in this case it can even be the longer leg. All of that irritation over time can cause uneven wear and tear in the lumbar spine, which can cause spinal stenosis, disc degeneration, and sciatica. Working our way back up to the top, you also can have potential shoulder issues and shoulder blade issues just due to the fact that the shoulders are often uneven because of the way they sit on top of the ribs, and the shoulder loading pattern will be uneven also, and patients will notice one shoulder potentially wearing out sooner than the other side. Depending on the degree of the spinal curvature, you can also have breathing and digestive issues, but that's a whole other topic that we can talk about at a later date if you guys are interested. So it's important when managing patients with scoliosis to take a holistic full body approach, which is what we take with every patient anyways, but you need to help them manage all of these little things, strengthen, fix mobility problems, and particularly focus on ergonomics and nutrition in a way that helps them manage and maintain their joint health and integrity. Have a good day, guys. Leave all of your questions down below.